Thank you for inviting me to share a little bit about what's happening at the VA and what we're doing, particularly at our site at Hines, and our academic affiliate is Loyola University Medical Center. And so the training program is through Loyola, but a large part of the rotations are here at Hines, and the integrative psychiatry piece is at Hines. So the VA's kind of interpretation of integrative medicine, they use the term whole health. And so they, about 10 years ago, have looked at cultural transformation and looked at, we're providing a lot of disease care, but what are we doing about health? So they have been rolling out steadily over the last 10 years this whole health approach to care. So they describe whole health as healthcare that empowers and equips people to take charge of their health and well-being and enables them to live life, with meaning and a sense of fulfillment. So you have that whole health approach, and then the VA looked at how do we implement this, and so they created this kind of system called the whole health system. So that's what you're seeing here of how this all fits in. So we're looking at the pathway, well-being programs, and whole health clinical care. So integrative psychiatry kind of falls into whole health clinical care. We'll talk about kind of each of these areas on the next slide. And this is all of this occurs within healing relationships and in a healing environment. So they're just not looking at clinical care, but the how the care is delivered and the environment that the care is delivered, and that this all should be integrated into the community in which the veterans live. So the whole health system, when we look at these three different areas, the pathway is really using health coaches and veteran peers that are trained to talk with veterans about exploring what is their aspiration, what is their mission in life, what is their purpose. And they start by kind of starting with a very overarching broad personal health plan that kind of focuses on strengths, preferences, and needs. So nothing prescriptive here, just kind of starting to get in a sense of where are veterans, what do they see as their strengths, and what are they aspiring for in their lives. From there, from the pathway, this personalized health plan helps to inform the well-being programs and where we might refer a veteran for well-being. And that is, the well-being programs can be peer-led or professionally led programs, but these include CIH approaches like mindfulness, yoga, Tai Chi, acupuncture, nutrition, and health coaching. So, and then you have whole health clinical care that looks at disease management, but also orients disease management into more of an integrative approach, incorporating the veterans' meeting purpose and aspiration, and looking at their overarching health goals and preferences. So just to kind of orient about why the VA opted to do this, they looked at this idea of transforming healthcare and how can we transform the care that we give veterans. And to that end, there was a policy that the VA released in, I believe it's 2015, that looked at the provisions for complementary integrative health. And they identified a list of integrative health treatments that they felt every VA should be providing or offering to veterans. And these are the treatments that are considered mandated that we have to provide, that are included in the veterans benefit packages, so that this care should be offered at the facility. And if it's not offered, then we have to pay for this in the community. And that's what CCN means. It's a community care network. So there are a few that are still not required to be offered in the community. That's guided imagery and yoga. But acupuncture, biofeedback, massage, clinical hypnosis, Tai Chi, Qigong, MBSR, all, if we cannot offer them here at our facility, we are required to pay for that service in the community and make sure veterans have access to it. So the Mission Act, a little bit about the Mission Act, that was that was passed, I believe, when the last administration, I think it was 2018. So the Mission Act really ensures that if care is not available on site, it would be offered in the community. So, and it's just not that that care is not available, but if the veteran has to, it lives far away and it's burdensome to drive. So anything over 30-mile distance, or it takes longer than an hour to get to the site, then the VA will make sure that care is provided in their community. And also, if for some reason that we cannot provide a quality or standard of care in-house because we don't have providers trained to do that, that falls under best medical interest, and then we make sure that that care is provided in the community. So there is just a real commitment to providing an integrative approach to veterans and making sure that they have access to these services. So this is the tool that the VA uses in talking with veterans about whole health. So it's called the Circle of Health. And so we're exploring here the mission, aspiration, and purpose with veterans. So this green area is kind of the domains of health and wellness. And so at the center is mindful awareness. We talk to veterans about really cultivating this sense of mindful awareness, present-centeredness, and awareness of what's happening in their body, with their mind, being intentional about, their surroundings, relationships, being present in these areas. So we explore kind of these areas. And so some of the questions we ask are, how do you see these domains being interconnected? How do you feel these affect your health? What are your strengths in these different areas? Where do you see yourself in your own confidence in being mindfully aware, or working through in these domains and shoring up your skills for self-care? Where would you like to be if you are feeling that you don't have these skills? And so we take all of this and kind of have these conversations. We weave in that mission, aspiration, and purpose. We talk about, the self-care and self-management strategies as a way to really equip veterans with a sense of autonomy, internal control over their experience, and really use the relationship, the therapeutic relationship, to build a sense of a foundational sense of health and well-being, in that the providers working with veterans in this way are an embodied expression of health and wellness, right? They're using these strategies themselves. They're talking about it from a place of experience, not a place of content and knowledge. So it's really an embodied expression of that. So it offers a kind of a space for transformation when you're meeting the veteran with a sense of present-centeredness, acceptance, and non-judgment. It offers that space for veterans to really find their own empowerment and have a transformative experience. So if you can see, outside of those green domains, we have that blue circle, which is the kind of professional care. So that professional care includes prevention and kind of disease management treatment, but also the conventional and complementary approaches. And all of this is, again, thought of in the context of community and really engaging veterans back into community and a sense of belonging. So this is these complementary integrative health domains that we looked at, those lists of services that we are required to provide. The VA in those 10 years looked at compiling an evidence map for acupuncture, for mindfulness, for Tai Chi, and for yoga. There's also another one now for biofeedback and hypnosis. So these are kind of what the VA has used as a foundation to say, yes, we should be providing this and we should be paying for this if we're not providing it, because it's critical for veterans to have these services. So I wanted to talk a little bit about us, our department here at Hines, and the Integrative Psychiatry team. So you'll see there's 5 of us listed, I guess 6 including me. But they're part of, we have lovely staff. They're amazing to work with, very dedicated and enthusiastic staff. So integrative psychiatry falls under the whole health clinical care aspect of whole health. And so there's a variety of things that we offer. We offer clinical services. We offer education and training through the residency with electives. And for our attendings, there's a tremendous amount of staff development, and we're just seeing funding come through for research and scholarly activities. So we're just been part of submitting some research proposals. So we'll see what happens with that. So I want to talk a little bit about the integrative psychiatry and mental health clinical services. So we offer a lot of population-based approaches because we want to maintain access for individual treatments, and for those veterans who are in need of more individual work, we want to keep that open. So we do a lot of group-based programming. Our program is called Thrive, which is Total Health Resilience and Improved Vitality. And we offer a foundational workshop that is Mindful Path to Wellbeing and Resilience. It's an 8-week workshop that focuses on teaching veterans a set of mindfulness and positive psychology skills. So this is really, we developed this because not everybody is ready for MBSR and 40 minutes of practice right off the bat. So this is a great, it explores mindfulness through mindful eating, breath, movement, and positive psychology skills of gratitude, kindness, savoring, flow. So after that, you can take food and mood, which is mindful eating and looking at and kind of some education around functional nutrition. And then we have a kind of second tier habit class, which again is focused primarily on happiness, cultivating deliberate good, and exploring the research around happiness, gratitude, kindness. And then we have another 5-week offering called Self-Compassion, looking at those skills. And we have a practice group for veterans who want more practice support. We are lucky to have a collaboration with the Veterans Restorative Project, which is a community organization that comes in and does I Rest Yoga Nidra once a week. And then I offer acupuncture in a group-based setting, and I do see a few people individually. We are starting in January our integrative psychiatry clinic, so we'll be doing the more detailed assessments, the more comprehensive assessments, and follow up looking at supplementation and nutrition and kind of tailoring more comprehensive plans. So I want to really thank Noshin and Amelia, because our education side and our training has really taken off with their support. This is the 3rd year now that we've had a PGY4 do an elective with us. We are in the process of asking to post for a PGY5 interdisciplinary fellowship for integrative psychiatry through the Office of Academic Affairs. And we think we will be able to get permission to offer a part-time fellowship for attendings who are wanting to continue to work externally, but are able to do a fellowship part-time with us. So that more to come on that. We are also, with Noshin and Amelia's help, are putting together a kind of a shorter elective rotation observership for other community programs that have we've had residents express interest from other community programs. So this is kind of a sample rotation. We start folks in our mental health intake center, which is our front door to our clinic, to our hospital mental health services. And if you are rotating with us, those mind body skills, those groups that I showed on the previous slide, you'll be facilitating at least 2 of those with me usually. And also we teach acupuncture. We just had the resident that's working with me got NADA trained, so she'll be able to leave and do NADA treatments. And then we have the Integrative Psychiatry clinic, which is kind of a consult clinic with those more detailed assessments. And then time for continuity clinics, some scholarly work, and didactics. And then, so this is just our staff development. We just this year were able to train 10 psychiatrists in NADA, the National Association for Detox Acupuncture. And we have plans to kind of deploy them into different areas. So in the emergency room, the opiate treatment clinic, general mental health clinic, and our homeless program. We have 5 mental health staff that we're sending for hypnosis training. We have 10 mental health staff that are getting trained right now in heart math. We have 2 that are getting that are trained in biofeedback, and 2 more that we're training, and 1 psychiatrist who's in the process of completing her lifestyle medicine boards. So we've been very, very lucky to get a lot of funding with this whole health rollout to support staff in getting the skills that they need. And just really quickly, I'll share a little bit about our acupuncture for sleep pilot, which we started, which we completed in February of 2020. We had our first cohort go through, and then the pandemic hit, and we had to kind of suspend in-person care. So and we've just resumed now. So we'll have more data, but this is the flyer that we sent to our clinicians and veterans, asking for, without any preference for diagnosis, anybody that's having sleep and would like to try acupuncture, send them our way. So we had 7 veterans that came through our group, 5 completed, and 1 dropped out because of work issues, and 1 attended 4 out of 6 sessions. So they're not officially considered a completer until they've attended 5 out of 6. So we use the Insomnia Severity Index Scale to look at our pre and post measures. And this was a protocol that we used. So auricular acupuncture for insomnia, 5 points. And in addition, we added 2 body points, head points, GV 24.5, which is between the brows, and GV 20, which is at the crown of the head. The only complaints were minimal kind of discomfort with needle insertion and occasionally bleeding when needles were removed, but no other adverse events were noted. So this is the Insomnia Severity Index Scale. So we had 5 people that completed that were considered completers, but we had only 4 that we had pre and post rating scales. So so with each of these, in each of the sessions, we also asked veterans to rate kind of on a 10-point Likert scale along different domains of depression, anxiety, stress, sleep, cravings, and pain. So we found that we had a really great response with this. You know, the Insomnia Severity Index Scale, you probably cannot see it, but 0 to 7 indicates there's no clinically significant insomnia. 8 to 14 is kind of subthreshold. 15 to 21 is clinical, and 22 to 28 is severe clinical insomnia. So what we found was that the sleep pilot, amongst our completers, we saw an average of 4.7 reduction on the 28-point rating scale, and it showed, everyone showed movement in the right direction. 2 veterans moved from clinical insomnia to subthreshold. 1 moved from a higher score in subthreshold to a lower score, and we had 1 veteran that moved to no insomnia. So, and that 10-point Likert scale, looking at pre and post treatment within that session, we saw that by week 3, the pre-scores had reduced by 50% for all of the veterans that were involved in the pilot. So basically, the sleep pilot showed a reduction over time in scores and decreased anxiety and improved sleep initiation. So we had to suspend this. We just completed our second cohort, and we're starting our third cohort. So I'll have more data in the coming months, but I'm very excited to offer all of these different treatments for veterans. And just in conclusion, the whole health is kind of the VA's approach to healthcare delivery that encompasses kind of integrative health and complementary strategies. And the early evaluation of this approach has been very positive, and we're looking to expand within psychiatry training opportunities, including the PGY5 Integrative Fellowship. So anybody interested, we would welcome residents and any attendings who are wanting to move to snowy Chicago. We would love to have you here. Hines is making a really big investment right now in integrative psychiatry. I just presented to our facility leadership. They're very enthusiastic and on board to expand clinical services. And VA has committed nationally to funding a lot of these initiatives, at least over the next 5 years. So very, very excited.